And welcome to this week's episode of NAMI at Home Facebook Live. I am your host, Gabe Howard. I'm here with you every week at 2 Central, 3 Eastern, every single Monday. Just mark it on your calendar right now. I mean, it's clearly the best show on the entire internet. I mean, it just has to be, right? But if you don't want to put it on your calendar and you're thinking, how am I going to remember this? You just have to sign up for NAMI Tennessee's email list. In addition to hearing about great events like this, you also hear about like our gala, our convention, our walk, and of course, legislative advocacy and curated content as it pertains to mental health, specifically for the state of Tennessee and on and on and on. It's a really cool list. I mean, the fact that you're not already on there is really just a failing on my part, and I would like you to fix it for me. All right. Well, thank you, everybody. And while we are still in a good mood, let's introduce our super cool guest. Charles, welcome to the show. Can you tell the folks who you are?
Yes, my name's Charles Miller. I'm the owner of Scenic Neurotherapy in Chattanooga, Tennessee.
That's it. That's the whole answer. Whenever people ask me who I am, people have a good 15 minutes. I mean, you can go to McDonald's. People are like, Gabe, who are you? There's a solid 15 minutes that go by. Charles, you're here to talk about ketamine today. Just real quick, what qualifies you to answer all of our questions?
Well, I am a certified registered nurse anesthetist. That means that we are your anesthesia providers in every surgery in all of Tennessee and uh, most of the United States. This ketamine is an anesthetic, and so it's my expertise, the administration and monitoring of people under anesthesia.
Awesome. Well, thank you so much. I have so many questions about ketamine. In the audience, we got so many questions that were mailed in and of course or emailed in. Wouldn't that be awesome? Like you just email it, you just like write a postcard, send it into the NAMI Tennessee offices. Yeah, we're a little more advanced than that. But here's how this works. While this is going on, just put your short questions in the comments, and Charles will answer as many as he can. And of course, we have a whole bunch of questions that we are going to get to, so we are just going to have a lot of fun. But you can type them in at any point. You don't have to wait for a special segment. Just type them right in there and I will monitor them. Well, let's just start off, obviously, right at the beginning. What is ketamine? What is ketamine infusion therapy? Let's just define our terms.
Okay. Well, ketamine infusion therapy is a therapy that's been utilized for ballpark of 20 years, fairly commonplace nowadays. It in the treatment of mood disorders and chronic neuropathic pain. It is one of the most effective means we have of dealing with certain types of mood disorders. And it's not so much something that blocks symptoms or something that just makes you feel good for the short term and then you go back to where you were. It's brain optimization. Um, we are actually stimulating a process called neurogenesis. It happens in response to the administration of a low dose anesthetic. There are many other things that cause this protein to release, but this is the most controllable and most effective form we have. And we use it to stimulate a form of brain optimization that leads to a remission of depressive symptoms.
Thank you so much for that. The big question that's on everybody's mind, and I would say this was the number one question that we got, and multiple people asked it. They've heard of ketamine, but they've heard of it as an illegal straight drug, or I'm sorry, an
Mhm.
illegal street drug. Is ketamine an illegal street drug?
Well, I used to, when patients would come in and ask me, I used to tell them, you're probably hanging out with the wrong people. It is, it's a lot of things, but first and foremost, it's a children's anesthetic. It's a non-opioid, it's non-narcotic. It is a DEA controlled substance, but because it has a history of being diverted from medical facilities and abused, and that's the street drug you're probably familiar with, what they call Special K. If it comes in the powdered form, in all likelihood, what you're getting a hold of is veterinary ketamine. Uh, Mammals use a lot of the same medications, and so the things that we use for people are is a lot like the same medications we use on our, in veterinary clinics. Um, Ketamine is the safest of our anesthetics. It is able to be given in larger quantities without depressing the vital functions such as heart rate, blood pressure, respiratory rate. And so that's why we like to use it with our more fragile, smaller patients, like with small children. It's approved for 6 months and older. So most children's anesthetics involve ketamine in some fashion.
So let's talk about ketamine for the treatment of depression, or the treatment of, is it for the treatment of depression, the treatment of mental illness? What is, when we talk about ketamine infusion therapy, what is it designed to treat in the mental health space?
If if I had to put just a label on it, we treat certain mood disorders like major depressive disorder, bipolar disorder, one and two. We treat generalized anxiety. We treat even certain types of OCD. It just depends on the individual, the way it presents for them. Because just like all mood disorders, very few actually present, as a mirror image of another person's diagnosis. It's very specific to the person, as are the way we treat them.
Thank you, thank you. So it's not a one size fits all. It could be right for you, but it also could not be, and that's of course why it's prescribed by a doctor. It's not something that you can just decide, hey, I want to try this. It's a conversation between you and a medical practitioner to decide if it's right for you, and then I imagine there's a screening process, and it's, I guess it's not over the counter. Those are the words that I'm looking for, right? You
It's
can't
not
you
like
can't just go
ordering a
do
pizza.
this.
No.
Yeah.
Um, our process is, there's certain requirements for any medical treatment. Some are because of, the requirements that health insurance imposes to make sure that this is a necessary treatment, that we haven't exhausted all other resources. And so there are certain things that, we're all used to jumping through these hoops. Um, but with this, it's looking at the individual, looking at making sure that they are well educated on what this is. And so, um, well, I know the way we do it at our facility, and I imagine other places do as well, we do consultations that don't cost the patient a dime. If you're paying for a consultation, you probably should question the ethics of the provider, because there's so much education necessary to be successful with this process. Um, Once the patient's educated, we help them. That helps them set adequate expectations, and we help keep them, I guess, with their eye on the prize throughout this process. And then afterwards, a solid follow-up with mental health providers to make sure that they're making the most of the gains they've made.
Awesome. So let's talk about how this would work. Let's walk through ketamine infusion therapy. You talked a little bit about the process, which is the consultation to kind of get the education, but let's go with the assumption that you are approved. What would be next? What would it look like? I know that aftercare is important, but what's that middle piece?
So the middle piece in the treatment of mood disorders, we will do a stabilization phase of 6 infusions over a 2 to 3 week period. Each infusion is specifically dosed to fit that patient. Um, the infusion lasts about 40 minutes. The appointments are about an hour and a half, because after the infusion wears off, we want to give the patient time to, I guess, recover and let the medicine clear from their system and make sure that they're doing well afterwards. And then once they're feeling good and ready to go, at that point, they leave with a driver. Um, Usually it's about 2 infusions a week for 3 weeks is the preferred method. Most places still go off the older process of 3 infusions a week for 2 weeks, but then there was some literature that came out a few years back that had us questioning if maybe we're moving them too quickly through the process, and so we've changed our process. But if people don't come to us with a mental health provider, we will pair them with one. We will connect them with one. It's one of those things. I'm an anesthesia provider. We, that's one thing that we find is we all do better when we stay in our own lane. I'm not here to replace your psychiatrist or your psychologist or counselor. I'm here to manage an anesthetic administration and make sure that it's done to the greatest standard of care, to the peak of our apex science that is developing and continuing the research around this, and to make sure that you get you know exactly what you come to look for, and make sure you understand what the goal of this is. And so I'm, just like we do in surgery. If we were taking a patient back for an open heart surgery, um, there's a lot of education that goes on. There's a lot of setting expectations and preparing them for what's about to happen. And when we educate patients, we remove a lot of the fear and doubt, and um, it is an overall much more comfortable experience from the patient's perspective.
I could not agree with that more. Now, the word infusion implies needles. Am I correct? Is it?
Hmm.
I've sort of got this somebody sitting almost like when you donate blood, sitting in the chair with the needle in your arm for an hour. Now I
Hmm.
know that no blood is coming out. I've sort of got that pictured in my mind. Is that kind of what it looks like? You've got the needle in the arm. You're doing the infusion. You sit there for a certain amount of time. Am I picturing this correctly?
Well, yes, we do use IVs, and so the needle, if you're familiar with IVs, a lot of people believe that the needle stays in the arm, but we use children's sized IVs, so they are very small and very, hopefully won't traumatize anyone too much. And then, yeah, that stays in the arm. The flexible catheter stays in the arm, and that's how it's administered. And it's a continuous administration over that 40-minute period. The trick is to get therapeutic blood levels and hold them to where we want them. So basically, we administer just enough drug at any given moment to keep your blood levels at a certain place. And that's what triggers the natural process of neurooptimization. It's, while ketamine, and then I imagine we'll talk a little bit more about it, but ketamine is more of a catalyst to stimulate a process and not so much of an antidepressant itself.
That's it's very interesting when you say to stimulate a process. There's and remember we're all lay people here, but what process is it trying to stimulate? That's I know that the way a lot of psychiatric medicines work are not well understood. Is it more is ketamine more understood how it kickstarts that process, or it's I know there's just a lot of unanswered questions in
Mhm.
general about psychiatric care. So I'm curious if ketamine falls under that window or if we know more about that process.
So, if and I may be, feel free, anyone out there, correct me if I'm, if I stated inaccurately, because I'm not a psychiatrist. Not, my familiarity with these medications is just based off of the amount of research we've done up to this point, and but my focus is more the anesthetic. Um, it seems that most of our antidepressants, our daily oral antidepressants that we take, they focus more on the neurotransmitters, increasing or controlling the release of certain neurotransmitters, holding them, at a certain place, between the neuronal connections. Um, and that stimulates a stimulation or an inhibition effect that will create an antidepressant effect, hopefully. What we do is we don't work with the neurotransmitters. We work on the neurons themselves. So it's a pathway thing. I tell people all the time, I say, if the neurotransmitters were cars, then the neurons would be the roads. And the reason we see this being so much more effective than most of our typical oral antidepressant therapies is that you can put as many cars on the road as you want, but if the roads are closed, you're not getting much communication there or much. Yes, so it's we correct the way the neurons are communicating. So even whether you have fewer neurotransmitters, more neurotransmitters that need that are being communicated, you get the brain can handle it. It doesn't get that traffic jam doesn't happen, which that traffic jam feels like most patients like kind of a brain fog, anxiety with an overwhelming type feeling, even with simple tasks. And so what we do is we optimize the brain's ability to communicate by increasing the brain's ability to communicate effectively. Um, and when the brain's functioning optimally, we see significantly reduced depression, anxiety, feelings of overwhelmed, improved clarity of thought. Um, and then you take that and you run with it. That's what the patient does, and that's where we give you back to your counselors and your psychologists, and then you work with the patients to build skills that the patient may have, may not have, may have tried in the past that didn't work. Um, it's when the brain's functioning optimally, all of these things just work better.
I could not agree with that more. Now, I know that you said that the initial process is, I believe, twice a week for 6 weeks. There may be some adjustment with that to your personal obviously work with your doctor. You're not saying that everybody's like that, but in general. But how long does it take to see results? Do you have to wait till the end of the 6 weeks? Is it the whole thing? Is it 6 weeks after that? How long before somebody who is coming in for ketamine infusion therapy, obviously because they feel poorly, start to feel relief?
So yeah, it is 6 infusions, but it's over 3 weeks, so 2 a week for 3 weeks. Each as far as yeah, it's all good. It happens a lot. It's but as far as improvement, it just depends on what the patient's struggling with. They could feel significant improvement after the first infusion. Um, One of the most aberrant neuronal pathways that can be created in a brain is suicidal ideation. It goes against everything that we are naturally wired. Um, it goes against completely our natural process in our brain of self-sustaining and self-efficacy. And we are always trying to improve our processes and increase our utility. And that's the way we're supposed to work. But with suicidal ideation, patients, um, it's very unnatural. And so the way our process works, that initial relief that people feel, oftentimes the first thing that resolves is the suicide ideation. It doesn't mean that they feel better. It doesn't mean that everything is wonderful again. It means that all of a sudden that overwhelming desire to just not be here anymore subsides. And you're able to kind of get out of your own head just a little bit to where your world expands, and you're able to actually maybe even fit some other people in it, or even just not be so focused on just the way you feel.
Very good. Thank you so much. Now, we do have a quick question from the audience, real quick. I know that you've addressed some of the mental health disorders and illnesses that it's for, but let's just clarify for Della. Della, thank you so much for being here. Is this just for depression, or does it help with bipolar disorder and ADD?
Well, those are two very different things. But as far as from a brain optimization standpoint, yeah, it works with these primary brain disorders or primary mood disorders like bipolar, major depression, PTSD, OCD, and anxiety. The reason we state these is because these are all kind of frontline actors that lead to other complications, usually down the road. ADHD or ADD is it has a kind of, if I'm not mistaken, a very different manifestation, and it's a different part of the brain that we're dealing with. That being said, people with ADD do see clarity of thought. They see greater, I guess, enhanced remission of the, the inability to stay on task. Being an ADD person myself, I'm more of a distracted type. If you look, when I talk, I oftentimes you'll see my eyes go all over the place, and that's just me trying to keep my focus. It's one of those coping mechanisms we learn. But with bipolar disorder, it's incredibly effective because it enhances the ability for the patient to control the emotional side of things. And so, instead of the wild swings from up to down, it kind of blunts those edges and gives the conscious or logical side of the brain greater control of the emotional manifestation.
Very, very cool. Della, thank you so much for the question. If anybody else has any questions, please put them on the chat and we will get to as many of them as we can. Charles, moving along to the predetermined questions, as it were. So the next question that we had a lot of people ask us, and especially found in our research, is you talk about going to an infusion center. It was always going. So the question came up, all right, can I get ketamine infusion therapy at home? Is that available? Will it ever be available? What is give us everything about home-based ketamine therapy.
Oh, so there's a significant and long history of problems that come with self-administering anesthetics. Um, Being somebody who has worked extensively in anesthesia, all forms of anesthesia, self-administration of anesthetics is just a generally bad idea, and it comes with along with safety issues. The reason you have someone like me with you, even with the simplest of surgical procedures, is because 99% of the time things can go right. You know, But then there is just that, there's always the chance that we can have certain issues. Um, Ketamine is what's called a soluble. It means it can increase secretions, like saliva release. Your nose can feel like it gets stuffy. There's a lot of components that go into each of our anesthetics and the side effects that are just that are undesired. And with ketamine, I was talking to a friend of mine who operates the New England ketamine clinic, and he is also an anesthesia provider. And I asked him, I said, have you ever had any issue with anything that's ever come up? And he said that he did have a patient. It's called a laryngospasm. The patient experienced. It's when the back of the throat closes up, and it's really difficult for the patient to reopen their airway. Now, as an anesthesia provider, it's something we deal with frequently, and we can go in there and fix it like he did, and he handled it beautifully, which is why he's there. But if you were home alone, self-administering this anesthetic, and it's you know, without having somebody that can handle anything that can come up, it puts you at risk, and that's why we're here. Is we're here to take the risk away from you, so you can come in and focus on getting well, and we to make sure nothing negative happens. Make sure the experience is wholly positive.
Now, one of the things that just occurred to me, so I apologize for not asking earlier, but you said it's about a 6 week run. Is that you're then, I don't want to use the word cured, but after the 6 weeks, do you ever have to come back? How does that work?
Mhm.
Is it six and out?
It's Yeah, I talked to somebody about that. It's like, I said it's not six infusions and fixed. It's six infusions, and we've reached kind of a peak point of optimization. And these aren't the numbers that I came up with. This is actually initially Yale Department of Psychiatry, which are the ones that kind of developed our processes with ketamine infusion therapy, along with um, several other institutions, Johns Hopkins, Oxford. They all agree that by six, I think it was like 98 or 99% of patients have reached kind of a peak neurooptimization that we can get in a short period of time. After that, it's time to start doing the work. It's imagine that I had a counselor, brilliant young woman that works here in the Chattanooga area. She mentioned it to me, and she said, basically, you're the hardware and we're the software. And I said, that's exactly it. We deal with the wiring of the mechanical nature of thought, the neuronal synapses, optimizing communication from a physiologic perspective. And then the counselor takes it from there. So after we finish the six infusions, we give you back to your counselor, or put you with a counselor that we recommend if you don't have one. And the two of you work together to build coping mechanisms to utilize. Imagine, and I ask this of all my patients that suffer from a mood disorder. I said, imagine what your life would be like if your brain did what you told it to. So that's what we're giving back to you. Okay, we're giving back to you the conscious control over your emotional state. But it takes skills to keep these emotions from overwhelming you periodically. You're so used to them, you're so used to whenever, a wave of emotion is coming at you that you just curl up in a ball and wait for it to hit you and just see what happens. I had a patient a few months back describe it to me as like, it's not so much that we made the bad stuff go away. It's just when the bad stuff comes, I'm now bigger, and it just hits me and bounces off. Whereas before it would just bowl me over. That's the difference in for our patients. And so it's you see, I told you I would do this. I would just start talking and just take you down a whole nother pathway. And so
No,
did I answer the
I
question
love it.
properly?
Yes, yes.
Okay.
It's this is super interesting, and I've noticed that it's oops, sorry about that. I had just a slight little technical problem. I've noticed that there seems to be two fields out there, like in doing research for this show, and
Hmm.
trying to be able to come up with good questions, and look like I belong sitting next to you, Charles. And there's a whole bunch of people, lay people, who have heard of this. They have heard of it, and they've heard of it, and they have basic information about it. And then there's an entire group of people that have never heard of this at all.
Hmm.
This is as foreign to them as, and these are all people in the mental health space, all people living with depression or searching for help. And it's a little bit bizarre to me, which actually created one of the questions that I'm desperately trying to find right now. Why have I not heard of this until now? So many people just simply haven't heard of it. And it seems like those who have don't have a lot of information about it. Is this just so new and so cutting edge that the information just hasn't been disseminated? Is there a controversy around it, or of course,
It's yeah.
is it a mixture?
A lot of it's the stigma with mental health, and I use this analogy sometimes with patients because what if this was not a treatment for a mood disorder? What if this was the cure for cancer? If this was the cure for cancer, it would be everywhere. Um, it's if this was the fix for people who struggled with autonomic disorders, or or it's if this was something that people could, if this was something that was, I guess, a visible physical fix, people would be all over this. This would be everywhere. It'd be the standard of practice, and there would be no issue with anyone. Nobody would ever question it. One of the things that uh, you know, but the stigma is the fact that it is mood disorders, that it is depression, anxiety. It's things that we all, those that don't struggle want to believe that this is a thinking problem that they cannot fall to because they can think their way out of it. One of the things that ketamine infusion therapy has taught us is that mood disorders are far more physiologic than we've ever really given them credit. And if we are able to, embrace the fact that this is more of a neuronal injury rather than an actual thinking problem, then we can start treating it, you know, medically, just with evidence-based practice. Um, because the research is out there. There's no small amount of research, and it's fairly conclusive. I mean, there are some questions about, are there additional receptors that could be hit, or additional medications that we could add to this that would help us make the most of um, most of this treatment process, and people are trialing things still, but for the most part, what we do know is that we know how ketamine infusion works. We understand ketamine. We've had it for around, using it regularly since the 1970s in most of our anesthetics around the world. Um, it's this is it's, I guess, it's all about stigma. That's why we haven't heard about it. That's why people don't talk about it. Nobody wants to mention that, they're on an antidepressant. That's not it's not good social conversation, especially in the South. We have this everybody's fine culture. Everything's fine. It's always fine. And that's something we've always struggled with. And the fact is, everything's not fine. People are struggling, and if we acknowledge it and help people get to where they need to be, we don't have to wait till they fall apart before, they start seeking, alternative treatments.
You've got a fan base. Rachel wants to support, or Rachel wants to give you a shout out and thank you for supporting NAMI Chattanooga. Of course, we do as well. She also has a great question that dovetails right with what you were talking about. What are some of the common misconceptions, or the stigma that is just following around ketamine therapy? Please bring them up and debunk them for us.
Um, the stigmas. Oh my, where to begin? That this is potentially addictive. So, can ketamine be potentially addictive? Absolutely. Any anesthetic has the potential for addiction. But the only time we see addiction with ketamine is with self-administration, whether it be a prescribed self-administration or whether it be an illicit self-administration. Um, it's one of these things, because we give it intravenously. It has a very short half-life. The medication goes in within 2 to 4 hours, depending on the patient. The medication clears their system after administration, and there's no drug in your system beyond, that 2 to 4 hours after completing your infusion. That means that any good you feel is you. It's not like a steady state drug that has to be in your system all the time. Um, there's a lot of people that believe that is the case, or that some sort of experiential process. I guess that's the other side too, is that this is that the psychedelic, what they call psychedelic therapies, um, lead to a higher understanding of self or an expansion of the mind. I wish that were the case. This is very physiologic. It's very mappable, measurable. Um, there's been tons of research done utilizing functional MRI, technology to actually image, areas of the brain that are communicating poorly and how these areas improve as we, you know, as we, as we go through this therapy process, starting with a single infusion and then, subsequent infusions after. It's this is all we, because that's really the two biggest stigmas I think I come across a lot. That this is, first of all, it's illicit. We had stressed that earlier. It's not. It's a children's anesthetic.
Right.
It's not potentially addictive the way we administer it, intravenous, infrequent over a period of time. There's no need for a wean off. There's no risk of dependency, so it can kind of be used safely and effectively as needed. Um, and I saw that Rachel also said, "Can you share some success stories from this therapy,
Yeah, we can chop
specifically
that
for
right up.
treatment-resistant folks?" That's one of those things. That's kind of what keeps me here. This is a very labor-intensive field, and it's because of the stigma and because of the misinformation that's out there. Um, we take a lot of heat. We take a lot of heat from uh, from even family, friends, colleagues in the medical field. They really they really struggle with the idea that this anesthetic could be stimulating this kind of change. From even mental health professionals, a lot of I think here's where the rubber meets the road. If this was not a physiologic, you know, I guess evidence based, heavily research practice, this would not be a thing. This is not something um, that I came up with. It's not something that any single person has developed alone. This is something that the group of psychiatric professionals and mental health professionals and anesthesia professionals across the country have collaborated and perpetuated this field to give us a better understanding. Now, we do struggle a lot with the stigmas, but if with the proper education, that's something that we pride ourselves on here, is that our patients are very well educated and expectations are set. I've had a patient that he wouldn't leave his room. I mean, that we actually had one where he couldn't even leave to use the restroom. He was so shut in by his anxiety. Um, and it's one of these, we see that's one of the more severe cases, but for the most part, it's you know it's everybody has their struggles, and now he's functional. He still struggles with different areas. He's by no means completely cured, but it's been about a year, and he's got a job. He's got a girlfriend. He's re-entering normal life after being somebody who was shut in for several years, just by his anxiety. And it's like that was a huge one for us. We do a lot of veterans. We do a lot of first responders. Um, PTSD is something that responds very, very well to to ketamine infusion therapy, and it's because these guys and girls that have either been exposed to trauma through their work or through wartime or whatever, even just in our day-to-day lives. They their issue with was not something that was brought on by a slow, steady decline and poor coping mechanisms and or poor choices or something situational like that slowly over time. This was a traumatic incident that happened to them, or a series of traumatic incidences. And so it's something that was inflicted upon them. And so when we give them a way out, when we get the brain functioning and communicating optimally, they pick it up and carry it themselves. Had one soldier. He was one of my. I consider him to be one of my greatest successes. We actually had him on a podcast uh, a little while back. He'd been blown up a couple times in Afghanistan. He wouldn't leave the house. He was wake up several times in the night, check the windows, check the doors. He was just in this constant state of panic. After it was, we went through the stabilization of 6, like we do, and then we did several boosters for probably 8 to 9 months. Would get 1 to 2 boosters a month. And it was just kind of to hold things together. After the first infusion, there was a significant change. Um, if I remember correctly, he took his mom and wife out to dinner because it was the first thing that he thought to do. It was he wanted it was what he had been wanting to do. He wanted to go out. He wanted to take his mom and his wife out for the evening, and that was a bit much for his first time out, and he realized that. But he was significantly better ever since that first infusion. And there were ups and downs along the way, but now he completely self maintains. He doesn't have to come see us anymore. He works with a counselor. He does his part to maintain his mental health and self maintain, but he's medication free. He was on a good half dozen medications a few years back, and he wasn't seeing the results he wanted to. So that's just two of the stories that that are my biggest successes. I wish I could have them on here because I know they would be happy to talk about it. But
I think those are absolutely amazing stories, and to that point, people are starting to ask, how do you pay for this? The first question that came up is, does Medicare cover this treatment? And the next question along the exact same lines, is it covered by most insurance? Is it expensive for a 3 treatment round? Is this covered by insurance?
well, any anesthetic administered without a procedure is an off-label use of an anesthetic. So, while insurance can cover it, doesn't mean that they will. In fact, likelihood they won't directly cover it. There's no actual code for ketamine infusion therapy. Um, and so there's no actual, if there's not an insurance code, it's difficult to bill, as you can imagine. So what we do is after we take people through stabilization, the 6 infusions, we will print them super bills. It's a bill with all of the appropriate codes, and we actually code it as a simple infusion with a specialty appointment. And it's just the way we found is best. And pretty regularly, most patients can get between 20 and 40% of their initial investment reimbursed to them, as an out-of-network uh, reimbursement. And so it's enough money not to leave on the table. A lot of people, and that's one thing I had when I got a new receptionist, she was like, well, people call all the time and want to know, what does this cost? And I was like, well, tell them. I said, this is not a secret. This is not a timeshare. We're not trying to get them in and then trick them into signing up. So I happily lay it out there. Each mood treatment is $350. The stabilization phase of 6 infusion, 350 times 6 is $2,100. We have special discounts. I think right now we knock $100 off of the 2,000, knock it down to 2,000 even if you pay it up front, and that commits you to the process of 6. And that's honestly the most important thing, is that we make sure that you see this all the way through. If this was something that somebody could do one and get any lasting improvement, um, then we would just do one. The reason we do 6 is because that's the standard of care, and so we commit people financially to the 6. Each One thing we do offer that I don't know is commonplace is that we offer payment plans. And our payment plan option, we use a company that lets us do 0% financing. So we don't charge any interest because we don't feel that people should have to pay more because they can't drop, 2,000 right out the gate. And so we just basically take the cost of treatment and spread it out, potentially up to 12 months. And so our goal is to make sure that finances, if you may have hesitancies about coming to treatment, but we don't want, a financial burden to be what keeps you from getting the help you need.
There's a lot of folks that are saying, thank you for being transparent about pricing, about insurance, things like that. I love what you said there. We're not trying to sell you a timeshare. We're not trying to trick you. Look, this is what it costs. Insurance companies being what they are. Obviously, you can call your insurance company. We'll try to help you as best as we can. But if you're paying cash for it, it's going to cost X. Now, it's important to understand that that's the charges of this gentleman's company. Is there an average in the, just so if somebody, who's not near you or not even in the state of Tennessee goes and they hear a different number, is there a
Oh, yeah.
general range that they should be looking for?
Well, most of the well, most clinics are members of the American Society of Ketamine Physicians, and we kind of all got together and agreed that we should set some standardized pricing, mostly because we are still pressuring Medicare services insurance companies to cover this as as a treatment option, and it's ongoing. But so most places will do between we set the range from $350 to $1,000 per infusion. Now that $1,000 per infusion, that's your Los Angeles prices. 350 was the lowest
Beverly
we could.
Hills.
Yeah, right. It's a different. It's a whole different world. And yeah, I don't know what they do, but they make a lot more than we do over here on the East Coast. And it's but with with ours, 350 was the base that we agreed to, and so that's what we do. And we would do it for less if we could afford to, but honestly, costs have gone up about 400% since we initially opened 2 years ago. Reason being is medical shortages with COVID has really caused our prices to go up. So we've been really working to make sure that we kind of save where we can to make sure we don't have to raise our prices. But eventually, all of us are going to have to go up, just like everything else. But we work really hard to keep this as affordable as possible.
Do you think this is something that, and I know your answer real quick is going to be yes, because that's a reasonable answer. So explain your yes, but do you feel that insurance companies should cover this? Like I said, you're going to say yes. I know you're going to say yes, but why? Why should insurance companies get on board covering this?
Well, it'd be cheaper for them. You look at people who are struggling and they end up in an inpatient treatment center um, because what they're doing is not working. A $2,000 investment in helping the patient optimize neuronal communication to where when the work they do, they actually get benefit from. To where when they, we can, one of the things we help do is, and it's, I think this is where the concept of ketamine infusion therapy versus the reality, this is not, this is very much a physiologic optimization, meaning that we kind of reestablish the subconscious things that happen in the brain, like um, the reward punishment system that kind of is built into all of us, that when we do things that are good for our mental health, we should naturally get a dopamine or kick. When we do things that are good for us, we get that boost. If we neglect our mental health, we feel worse, and so it drives our practices to optimize mental health. The problem that we see a lot is you know over time, and especially people who are medicated, they don't feel things in a better, they don't feel better, they feel less. And so if you're feeling less, um, you're not getting a reward when you do good. Even though your actions are good, you consciously know that I'm doing what I'm supposed to do, but I just feel the same all the time. And then if you do worse, you don't feel low either. And so by taking away that reward punishment system, people just perpetually start to trend downward because when they, doesn't matter what they do, they don't feel differently. And so they do nothing. And so that's that people oftentimes, especially the patients that I treat, have been inpatient at some point, and so there's almost no chance. Like for if even if we only did the ones that had been an inpatient before, um, yeah, we're significantly cheaper. Our efficacy, so I guess our patient reported remission of depressive symptoms is about 85 to 90% right now at this clinic. Everybody keeps their own numbers. And you're welcome to ask them what they are. We all use special types of surveys and patient ways patients can report their trends along the way. And it does two things. It lets me know if somebody's struggling, I know who to reach out to. It lets me know if they're doing great and I don't hear from them in a while. I don't have to sit around and wring my hands and worry that they're not, that they may be in a bad place. I can just go check their numbers and they get like a daily like 0 to 10 that I have them fill out through an app that we use, and they can kind of, and it's their way of keeping us in the loop on a daily basis. We know what's going on with this patient. A little place they can put a little note like, oh, it's my birthday, and so you see their numbers go up to a 10, or if their numbers dramatically dip to a 1 or a 2, and you can go in there and see if it's if everything's just terrible, and then you're like, hey, maybe it's time for you to come in and get your booster, or if my dog died, and that's a reason to feel low. Feeling high or low is not necessarily something to avoid. We have to feel these things because it helps us process. If it's circumstantial, it just, anyway, it's just, That's one of the things that helps us keep up with our patients, keeps them out of facilities, keeps them from falling off our radar and ending up in a facility. So yeah, if insurance paid for this and patients could regularly use us as a, I guess, the physiologic support of their mood disorder, yeah, we'd save tons of money for mental health.
I I appreciate you saying that. I know it's always difficult to answer questions like that because the cynic in me would be like, well, but if insurance pays for it, then your company will make more money. That's why he's saying it. But I do want to stress that it's more than that, and of course it's backed up. And from our perspective, we just want people to have all of the options available and be able to choose. And sometimes some of the options that may be right for somebody can be cost prohibitive, forcing them to pick a less desirable option. And that's not good either. I
Mm-hmm.
respect cynical people. I am a cynical person, but we also have to look at it from all sides, which is we want people to have as many choices as possible so that they can make the best one for them.
Mm-hmm.
Charles, we got a couple of questions about, I'm going to read two of them back to back. The first one, oh, whoops, I did it in the wrong order. Is there a difference between your clinic and say one in Knoxville or Nashville? I'm assuming that is probably part of the same chain. And then Rachel built on it, sort of speaking to Della's question. Do ketamine treatment centers vary? For example, do all of them understand how important therapy is, or do some of them just skip over that? Is there any standardization?
Yeah, well, I don't think anybody would ever deny the role of therapy. I mean, even with us, our therapists that we refer to, our counselors, psychologists, they are the other half of our process. They are not a small piece of us. We do have some counselors in office that we use. Uh, we have several in the region, and our region is getting bigger because as patients travel to us from a little farther away, we try to keep one or two counselors on our books that we know our, understand what we do and can pick up patients pretty seamlessly from us. What's different? There are so many differences. There are many places. There's a guy in South Carolina that after a 20-minute Zoom call, so less time than you spent on here with me, he will send you injectable ketamine and you can inject yourself at home. It is not illegal to do so but it does pass the entire risk of something going sideways, and people do die from self-administering prescribed ketamine. Um, but the problem is until we hurt either enough people or the right people, there won't be any regulation because there's so much to be done out there in medicine, so much to regulate, and this is just one of the many things. And so unless it gets loud enough and there's enough of a problem, so there are clinics out there that lean heavily into self-administration. We do not do any form, any send home, take home version because method of administration is probably the most important piece of getting the most out of this. Now, can somebody do fine with other forms of administration? If I said, oh, if you said fine, but I want to do it, I want to take oral ketamine, or I want to do intranasal ketamine, or I want to do these other forms of ketamine. Take it in different ways so I don't have to get that IV. Um, we looked at when we opened up, we had to kind of figure out, why we do what we do and why we don't do what we do. And every single practice in any ethical clinic, they'll be able to defend what they do and back it up with peer-reviewed research. And so I had to make sure that everything we did, we had a reason for doing it the way we did it, not just for convenience or financial gain. Um, so, like with the bioavailability, I hope I'm not getting too medical here. So, bioavailability is the amount of drug like if I take 100 milligrams of ketamine through a certain route, or 50 milligrams of ketamine through a certain route, it's how much of the drug actually gets to the receptors we want to reach. Um, so bioavailability means like if I give someone 100 milligrams intravenous, 100% of that drug is going to get to the receptors I'm trying to hit. So that's why we do IV. It's considered the gold standard. It's the only way to control and guarantee administration is optimal and that the patient is going to get the absolute best results. Um, and usually I only have one shot with patients. And so because I only have one shot, I'm going to throw the best I have at them. In intranasal, as far as absorption and functionality from that side, I think as far as the bioavailability, it's between 8 and 40%, depending on how stopped up your nose is that day, if the individual's anatomy, all of these things play a role. It is this is it's if you take it orally, it's all about blood levels. It's all about keeping your blood levels at a therapeutic range for a period of time. The only way to optimize that is with intravenous administration. um, and anesthesia, we're all about blood levels. That's what I was explaining to somebody, that the whole way we wake, how do we wake you up from surgery? We stop giving you anesthetic. We give it to you continuously, hold your blood levels to a certain place, and then we just turn it off. And then when it wears off, you wake up. It's the same thing with ketamine. It's how do we stimulate this process where we hold the blood levels to a certain point for a period of time in that range where we want to be, and the patient eventually, it makes sure that the patient releases enough of this neuroregenerative protein that stimulates neurooptimization and has the antidepressant effect. There's no other method of administration that will actually get you the full release like intravenous, and that's why we offer only that. There are places that will offer all of it.
Wonderful.
Um,
So it sounds like there is some variation, but pretty standard. And those are some good questions to ask when you're making an appointment or in your initial consultation to make sure that they're doing it correct for you.
one
But
more thing I'd like to touch
if
on is,
please.
going back and to method of administration. There are a lot of clinics out there leaning heavily into a practice called ketamine assisted psychotherapy. At Scenic Neurotherapy, we use minimally stimulated ketamine infusion therapy. So those are the two things you'll see out there, and those are places where you'll go. And it's important to understand the difference. Both methods people benefit. It's not so much about right or wrong, but more optimal versus suboptimal. Meaning, who gets the most, what can we do to make sure that this patient's chances are their greatest to get as far as they can and do the best they can. Um, so with that, minimally stimulated ketamine infusion therapy, which is what we do, focuses heavily on the established science. It's not experientially based. The experience can be beautiful, wonderful, cathartic. It can be relaxing. It can be even, it just depends on the individual, but it is very individualized. Some people don't care for it at all. Some people think it's the greatest experience of their life. Um, but we make sure that the dosing is optimal, the education is appropriate, and that we have spent enough time teaching this patient what success with ketamine infusion therapy is, to where we have good expectations, and then they leave us doing better, and they know how to chase and be better. Um, one of my concerns with this is that, with ketamine assisted psychotherapy, it leans heavily into the experience. Now, when we lean into the experience, um, I get some people do better with a hand holder, is what we call them, and we offer those. We can be them. We can be them for our patients, or we can have a loved one come in. It's all about the patient's comfort, but we try to keep stimulation to a minimum, because if we give optimal dosing, which is what the science says, this is where patients do the best between this dose and this dose. Um, you can't really talk to the patient. And so that means that with ketamine assisted psychotherapy, they have to bring that dosage just beneath the optimal ranges. But now we can do kind of a therapy session under the influence of ketamine. Now, under the influence of ketamine, you are not enhanced. Um, you're not at a higher plane of thinking. You're inebriated. It's like doing counseling on a drunk person. And for my counselors out there, if I haven't, I may be wrong, but that's fairly unethical. Um, it's something that they can charge an additional charge. Most people will tack on an additional $150 for a specialized therapy session. It increases. So from a profit standpoint, it is incredibly more profitable to do this. But from a patient outcome perspective, you knock about 10 to 15% off of a patient's potential to do well by, I guess, stimulating them through it and decreasing that dosage to, I guess, so you can talk to them during the treatment. And so one of the things we see out there, as far as that's is the differences between clinics, you'll see those that really embrace an experiential clinic. We jokingly call them shaman clinics. They guide you to a higher level of thinking. This is a medical treatment. If this was an experiential treatment, this would not be a thing, because Yale's Department of Psychiatry would have never carried it forward. There wouldn't have, the neuroscience would be negligible. If we're just guiding you to a greater understanding of self and universe and whatnot, that would be great, but we're not. We are helping you, we are stimulating a physiologic change in response to the administration of a low dose anesthetic. Now, during the treatment, it can be very, very relaxing, very cathartic, very beautiful, and you can feel like you're having breakthroughs, but that's not what's causing the change. That's a side effect of the physiologic change, of that protein releasing into the brain and rapidly enhancing communication. Things just feel smoother, easier. You're thinking better and more clearly. And so, and that's, I guess, leaning heavily into the experiences where we see people fail, because usually if they lean too heavily into that treatment being what fixed them, then when they go out into the world 2 weeks later and they're like, oh, it wasn't real. And it wasn't. It's like a dream. It can leave you feeling good, but at the end of the day, it was just a dream, and it didn't change the reality of who you are and what you've been through.
Charles, thank you so much for spending the last hour with us. It goes by so quickly. We only have a minute or two left. Do you have any final thoughts or words or anything that you want to put out into the world for our viewers to make sure that they understand everything that they need to know about ketamine treatment?
I wish, and I was worried an hour would be hard to talk. I feel like there's 10 things I didn't get to, that I wanted to answer. But it's really what this is all about our patients. This is all about getting them to the next level. The counselors that have been out there working with them, everything you've been doing with them has been working. You guys have been doing an amazing job. It's just there's only so far you can get with some people, as far as helping them. It's like there's a wall they keep hitting. We help tear down that wall. We're the next logical step. With medication management, it's working. The problem is it's not a good long-term plan. Patients don't stay good all forever. And holding someone's what we call stabilization is just holding them still. We need to keep them moving and keep them growing. And so that's what we help them do. It's like we're the next logical step. We work with prescribers. We work with counselors. We're here to make your patients do better, make you look good. And not that you guys aren't doing that already, but
Wonderful. Well, thank you so much. You got a lot of thank yous in the chat. Whoops, I think I'm hitting the wrong buttons over and over again. Bunch of thanks you. You had great info. Thanking us both for clarifying and getting everything out there. So we are so super excited we could have spent an hour, or that we did spend an hour with you. Before we drop off completely, I want to remind everybody, oh, I can't find my magical little button. Hang on. As soon as I do, it's going to be, look at that. NAMI Tennessee's email list. Remember, we do this every Monday, 2 Central, 3 Eastern. And you can find out about stuff like this by joining the NAMI Tennessee email list. It's absolutely free. And we tell you about things not only like this Monday offering that we offer every single Monday without fail, but you also learn about things like our convention, our gala, our NAMI Walks program, legislative advocacy, and of course, all of the things that's going on in the state of Tennessee. So it's a really cool thing to sign up for. And as I said, it's absolutely free. Just head over to namitn.org and sign right up. Thank you so much. And we'll see you next Monday here on NAMI Tennessee Facebook Live.